Welcome to Healthcare Financing in Oregon, Module Number 2. My name is Sarah Barron, and I have work experience as an educator, community health outreach worker to grant development. I'm currently a public health assistant professor at Central Oregon Community College, and I'm also a certified peer support specialist. This module is part 2 of a 3-part module, so let's get started. The following are the learning goals. Learning goal number 1, identify the major funding sources for healthcare in the United States. Goal number 2, identify how Medicaid is accessed in Oregon. And learning goal number 3, identify the role of the local coordinated care organization and discuss local healthcare systems. Learning goal number 1. We're going to look at the major funding sources for healthcare in the United States. So when we look at the healthcare system, it is funded from both public and private dollars financing. Public includes federal across the United States, individual states, and local government. And so you'll see here in this slide, you'll see public financing, and with underneath it, federal and state government and local government. And private financing, which is looking at privately insured individuals who are contributing directly to their health insurance and or employers. The health financing system, as I was saying in the previous slide, is funded from public health care in the United States by tax dollars by the federal government, so federal tax dollars, state government tax dollars, which a lot of times federal dollars are passed directly through the state, and then local government agencies, so local taxes and funds. And then I was saying before, private health care, so the private side is looking at individuals who are contributing, who are paying into their health insurance or paying fee for service, or they're with a private group like a foundation or a charity, or their employer is providing contributions. And so when we talk about the employer, a lot of times when people are signing up for a job, human resources will go over the employee benefits and the contributions that will be paid by the employer towards the health insurance. This chart provides an overview of how funding flows from the federal government to the state government to public insurances and institutions. At the very top, you will see the federal, local, and state government coming in at the very top, and then you'll see the funding flowing through to different federal agencies like the Department of Health and Human Services on the left and the Center for Disease Control. These are just few of the federal agencies. And then you'll see the Department of Health and Human Services, and you'll see the Centers for Medicaid and Medicare. And this is providing funding through Medicare, Medicaid, and CHIP. And this is providing both local and state funding. All this funding is coming down to support these insurance programs. And at the same time, funding is coming down to support the hospitals, scientific research, and regulation. So a lot of these tax dollars and that you pay into and that we use in the United States are supporting our healthcare system, from public insurance to regulations and support for hospitals. We will be talking about public health insurance. Medicare is one of the largest sources of public health insurance in the United States. It serves the elderly, the disabled, and those with end-stage renal disease. Medicaid is one of the third largest sources of health insurance in the United States, and it provides coverage for low-income adults, children, the elderly, and the disabled. And how I remember the difference between Medicare and Medicaid is Medicare, we care about elderly, the disabled, and those with end-stage renal disease. And Medicaid is provided as aid to low-income adults, children, the elderly, and disabled. These two can also work together and provide insurance. There's also the Children's Health Insurance Program, which provides insurance to children in uninsured families, and community health clinics, which are federally funded clinics. Medicare is one of the largest sources of public health insurance in the United States. It serves the elderly, the disabled, and those with end-stage renal disease. And one of the key things is it provides care for those who are late adults and with certain conditions. It is administered through the Social Security Administration, and what's really important to also remember, it's required to sign up. People need to sign up at age 65 years of age to avoid a penalty fee. You'll see that again, it's administered through the Social Security Administration. If you look closely at your paycheck, you will see one of the funding sources that is used towards Social Security. It's called the Federal Insurance Contributions Act, and it definitely supports retirement and services. FICA, F-I-C-A, is a U.S. federal payroll tax, and it stands for Federal Insurance Contributions Act, and it's deducted from each paycheck. And it ties to the Social Security Administration and to your Social Security benefits. FICA supports and funds both Social Security and Medicare programs, which provides benefits for retirees, the disabled, and children. Another key benefit, and what's really key, is in the news, often we're hearing about the rising costs of pharmaceutical drugs. And policies are definitely being passed to address these costs. For example, the prescription drug law went into effect on January 1st, 2023, and it covers more vaccination, lowers the cost for insulin. We are lowering the cost of out-of-pocket drug cost. And Medicare is beginning to negotiate, as I'm recording this, to lower drug prices. And this negotiation is a set of series of talks to really look at standardizing the price for both Medicare Part B and D drugs that don't have competition. And competition is something that helps control costs. For when there's no competition, costs can rise and be very problematic and expensive. So this prescription drug law is something that the federal government is working on as we speak and will continue to work on. The military care system, TRICARE, provides medical care, education and training, research, contingency support, and emergency management. It is available mostly free of charge to active duty military personnel of the U.S. Army, Navy, Air Force, and Coast Guard. And it also provides services to non-military agencies such as the Public Health Services. The military medical care system is very organized and highly integrated. It offers comprehensive services, both preventative and treatment oriented. And a speaker's note here is very important to make sure that if you're working with someone who has TRICARE, that you're going to a hospital or a doctor that is in the TRICARE system. Next, Health Resources Services Administration. There are federal community health centers, and this is one of the many different healthcare centers that are across the United States. And within Central Oregon, two examples are the Lapine Community Center, which has different centers throughout the Lapine area, and also Mosaic Medical, which has 15 plus different locations. These are another example of federal funds pushing out and providing resources to increase access. The next two learning outcomes are going to look at how Medicaid is accessed in Oregon, and learning goal number 3, identify the role of the local care coordination organization. Medicaid is called Oregon Health Plan in Oregon, and Medicaid is one of the largest sources of health insurance in the United States. It provides coverage for low-income adults, seniors, pregnant women, children, and individuals with disabilities. Medicaid provides aid based on income criteria. Each state operates its own Medicaid program within federal guidelines, and I want to point out that each state has a great deal of flexibility in designing and administrating its program. As a result, Medicaid eligibility and benefits can often vary widely from state to state. Certain states have different names for their Medicaid and child health insurance programs. For example, in California, both programs are called Medi-Cal and are under Medi-Cal and integrated to each other. And Georgia, Medicaid is called the Medical Assistance Program and tied to a PEACH, and then their CHP program is called Peach Care for Kids. And in Washington, there's Apple references, Apple Card. So you can look up at how each state differs and also look up the name of the Medicaid program. You can look at this on this website that I will provide in a handout for this module, and also you can drill down. Again, in Oregon, the Medicaid program is called Oregon Health Plan. The funds are passed through the federal government to the state government, as I said before in the previous slide with the org chart. And the state agency that administers these funds is the Oregon Health Authority. The Oregon Health Authority is a state agency, and it oversees distributing Medicaid's funds or Oregon Health Plan to different insurance programs through the state of Oregon. The Oregon Health Authority contracts with coordinated care organizations to distribute and oversee and provide Medicaid resources, or the Oregon Health Plan. If you look at this chart, which I will also provide in the handouts, this map, you'll see that the different colors here, orange, pink, each one of these are coordinated care organizations, and they've been assigned to different areas. Within the Central Oregon area, the coordinated care organization is Pacific Source Community Plans. For your area, you will have a different coordinated care organizations, and in some case, you may have 2 different coordinated care organizations. I provided a link to this map in your handouts, so you could take a closer look at this map and look at which coordinated care organization is assigned or contracted to provide Oregon Health Plan services for your area. Each coordinated care organization will have a solutions handbook, a member handbook that you should definitely download that will help you navigate the coordinated care organization's system, because each coordinated care system has a different approach in providing and distributing the Medicaid Oregon Health Plan services. It is important for you to download that handbook. This example is a screenshot of the Pacific Source handbook, and this is your handbook. If you're in the area, you would download the region that you're in and download the handbook. Again, I will provide a link to those resources in the handout so that you can look closer at where you need to download the handbook. If someone does not qualify for Medicaid, Medicare, or public health insurance, then their option is private insurance. And I was describing before, private insurance is through employee contributions, or individual contributions. One key area to really point a person as they're shopping for different insurance plans, let's say they do not have access to an employer insurance program, then they should look into something called the marketplace. The marketplace is an exchange that each state has where people can individually shop for insurance plans and also look at subsidies to support and lower the cost of health insurance. So when in doubt, check out the marketplace. And there are many different assisters and people that can assist when navigating the marketplace if you need more information. Again, I'll provide that also in the handout for you to take a closer look at the marketplace. In summary, we covered that the United States both uses public and private funds to finance healthcare. Examples of private insurance are Medicaid, CHIP, which is the Children's Health Insurance Program, or TRICARE. Those are examples. In Oregon, Medicaid is called Oregon Health Plan and is administered by insurance plans for specific areas called coordinated care organizations. On the private side, people can pay for their health insurance either from support from their employer or through assistance through the marketplace for purchasing an insurance plan.